This is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. I'm a specialist in chronic and rare disease and now a specialist in chronic and rare untreated disease. And we are entering a very dangerous time in our medical history. People are going to the streets. People are killing themselves, all because they're being yanked off their pain treatment regimens at the insistence of the government. Why is the government worried? This is why. There's a poster of a movie about cocaine fiends. It's funny, the drugs don't make any difference. It's just drugs. I'm a doctor. Somebody says they're on drugs. I say, what kind of drugs? It makes a difference. But you notice the sexual innuendo, right? This fear goes back to the 1900s, and it's all about foreigners and sex. Here's another. This is a movie poster for the movie Reefer Madness, which you can still download and watch. It was made in 1936, and it shows what happens when people take narcotics. Turns out it was marijuana. So they didn't even get it right. But this is what the government's afraid of. So the government has decided to describe safe prescribing. So what is that? First of all, the implication is that I'm not prescribing safely. And because I'm not prescribing safely, all these people are turning into dope fiends because I am not prescribing safely. So, what is safe prescribing? So you look over here on the list, doing a comprehensive physical examination and history of the patient. Duh. Screening for abuse. Duh. You just say to somebody, are you an abuser with the door closed? That's it. You don't need to do anything else, and they'll say yes. Utilization of the Prescription Drug Monitoring Program, which is a national surveillance of doctors and patients for the purpose of law enforcement. Used to be a good idea. Pain clinics back in Florida 10 years ago, people were running around getting multiple prescriptions because there was no way to track them. So that's a good service for doctors to use, but it's required. It's required in a lot of states. That you have to have an appropriate diagnosis. Are you kidding me? This is what the government thinks we doctors are doing. And they have no evidence whatsoever. Nobody's done any studies that doctors are doing the wrong thing. They just made the assumption. Establish that the drug is medically necessary. So what do? We just hand out prescription drugs to people that aren't medically necessary? Obtain an opioid agreement. That's a contract. Why are people required to sign a contract in order to have pain medicine? This is the government. And what part of the government? This is all coming from the CDC. The CDC said that it's a good idea to have urine drug tests on pill counts where people have to rush in and count their pills and these contracts. And then the CDC said, but we have no evidence that they work. Well, that's nice. This is typical of the government practicing medicine. Consider up to 40 milligram equivalent as a low dose and 90 milligrams as a moderate dose. 90 milligram dose oxycodone is only enough for a good-sized dog. 40 milligrams you'd give to a cat. So where do these numbers come from? They came from the CDC. Where did the CDC get them? They came from an organization called the Physicians for Responsible Opioid Prescribing, which in itself is an incorrect statement. Further on, periodically assess the patient. No, we just give the patient medicine, never see him again. That's really insulting. So, monitor for adherence, abuse, and non-compliance by using urine drug tests and PDMPs. This is ludicrous. This is not how you check on patients. They think, checking the computers is going to find these criminals. No, all you got to do is ask them in the office, and then you treat them. The reason we have such a massive problem with people being cut off, doctors going to prison, is because we're not treating all the people with addiction disease. We're only treating 20%. That's pretty bad considering the amount of money that we spend. So what's going on? Where's the money going? Well, one of the places it's going is to rehab chains, because they get $1,000 a day. And our drug rehab in this country is not regulated. That means they can do whatever they want. Not good. We at the National Pain Council are going to be looking at making recommendations for all drug rehabs to be regulated. This will allow more people with addiction disease to get rehab, medical supported rehab, and the more you have, the less you're going to have on the streets, the less crime you're going to have. It will solve the problem. It's solved the problem in other countries, Switzerland, Portugal. I mean, their crime went to almost zero. Overdose is almost zero. But you see, we've got some other kind of bias. We don't really want this to happen because the treatment of opiate addiction has become a thing in itself. And this has been going on for 50 years. But now we've got casualties we never had before. We're estimating between 5 and 8 million people have been discontinued from their prescribed medications against their will because of safe prescribing. So safe prescribing is really not safe prescribing at all. It's a myth generated by the government. In my own case, the problems I had with the medical board had to do with the government rules, not with rules from our medical profession. These rules that were made up by the government. Just a few little things. We have every book that you read, every article you read on safe prescribing starts off by saying overdose deaths have quadrupled since 1999. That's pretty impressive. So what we did at the Pain Council, we went back 15 years before that. Guess what? Quadrupled. The reason the number of overdose deaths is increasing is largely reporting, and whenever there is more interdiction, more police, more state laws, the death rate goes up and the cartels have a heyday. We don't talk about alcohol very much, but 5% of alcoholics are actually in the same boat as people with addiction disease. It's the same problem with the brain receptors. They cannot go without alcohol. They have withdrawal. That's different than most heavy drinkers. But here is how the government interferes with alcohol. There's a Substance Abuse and Mental Health Services Administration. Only in the United States do we have a Substance Abuse Administration. And they come up with these laws, for example, or rules. 2 or more drinks for women and 3 or more drinks for men on any day is too much. That's the government practicing medicine. 3 or more drinks for women and 4 or more drinks for men on at least 2 days in the past month. This isn't based on science. This is people sitting around making up stuff. And we just have a little quote here. It's very important to remember. The CDC director, when the CDC guidelines came out, said that overprescribing opioids, largely for chronic pain, is a key driver in America's drug overdose epidemic. Number one, I'm not sure what he meant by overprescribing. We doctors don't really know quite what they're talking about. Is it too many people? Too high a dose on the average? They've never really defined it. We hear a lot from the government, but they don't know what it is. Overdose epidemic, we've talked before how it's 1 person per year increase in the overdose deaths, all heroin addicts. That's not an epidemic. And lastly, we have a paper here called New Survey Confirms that opiate deaths do not correlate with pain pill abuse or addiction rates. So the overdose deaths don't have anything to do with prescription drugs at all. And what we're going to do is we're going to start posting these articles on the National Pain Council website so that you can read them and decide yourselves. Lastly, I thought this was kind of interesting from one of our National Pain Council members. They were trying to fill a prescription. The pharmacy said, we're not going to fill it because of one of those red flags. Or there's 132 red flags, by the way. So when I did, I went to the other pharmacy and they said, you're doctor shopping. So I'll end it with that, and we're going to have some more shows here in the future. And go to the National Pain Council website or send us an email and go to suspendcdc.com. We've got to do something. The purpose of this is to be counted. The government has no idea how extensive the damage has been. Good night.